All right. So today on APHA's Disability Section Leading the Way podcast, we have Dr. Monika Mitra, an Associate Professor of Disability Policy and the Director of the Laurie Institute for Disability Policy at Brandeis University. Her research examines the healthcare experiences and health outcomes of people with disabilities, with a particular focus on the sexual and reproductive health of women with disabilities. Her current research revolves around the health needs and barriers to perinatal care among women with disabilities, including women with intellectual and developmental disabilities, and those that are deaf and hard of hearing. She is currently co-leading the National Research Center for Parents with Disabilities, focused on addressing knowledge gaps regarding the needs of parents with diverse disabilities, and the Community Living Policy Center, aimed at improving policies and practices that advance community living outcomes for people with disabilities. Dr. Mitra is the co-editor-in-chief of the Disability and Health Journal and the 2017 recipient of the Alan Meyer Awards from the American Public Health Association's Disability Section. The Disability Section awards one recipient each year who has made significant contributions to the field of disability and the lives of people with disabilities nationally and internationally. So we are very excited to welcome Dr. Monika Mitra.
Well, hi, Liz. I'm excited to be here as well.
Thank you. Thanks for joining us. So to get started, would you mind telling us a little bit more about your research in disability and public health?
Sure. So I have been researching or part of this disability section as well for a long time. And after I finished my doctorate in 1997, soon after I started working at the Mass Department of Public Health and really became passionately interested in working or looking at disability from a public health lens. So really working at that intersection between disability and public health. I have a number of areas of interest. Some of them are examining violence victimization against people with disabilities. I'm also interested in looking at community living policy, but the part of that I'm really, my focus is on sexual and reproductive health of women with disabilities. I'm particularly interested in the perinatal health experiences, health outcomes, access to care during pregnancy and postpartum among people with disabilities. And what I'm keenly aware and interested in is sort of that the life course perspective for this. So not looking at it from one point in time, but looking at it as a continuum. And it's important to do that because people with disabilities, as you know, face disparities and a disproportionate burden when it comes to health outcomes and negative experiences. And what we've seen is that they carry this through to their pregnancy. So by the time someone is pregnant, especially someone with a disability, what they face is this cumulative burden, which leads to potentially a number of negative birth and maternal and birth outcomes. So that's really in the last, I'd say 5-7 years has been the focus of my research.
Wonderful, thank you. It's such a interesting and important line of research. I'd love to know more about what prompted you or led you kind of down this career path and for this line of research.
Sure. So this was about, in the early, maybe 2012, 2013, I was writing a paper on physical abuse around the time of pregnancy. And while we were physical abuse around the time of pregnancy among women with disabilities. And while we were writing this paper, how you do a literature review. So I started working on the literature review, and there was this emerging body of research on violence victimization in women with disabilities. But when it came to the literature on pregnancy and perinatal health, what I found was a complete absence of literature. And I couldn't kind of understand this, even though, and Liz, as you know, and I know, is that when it comes to disability research, we're used to seeing gaps. But this was a significantly larger gap. And as I said, it's almost like a vacuum. And I couldn't kind of understand why this was. and I think in the US, there was just a couple of studies, and they were, usually like really with small numbers, or kind of more like case studies, but not anything extensive, and certainly not using large data sets. So that really got me interested, and what I eventually realized was, some of this is also to do with the way women and people with disabilities are perceived in American society, and potentially in other parts of the world as well, and as non-sexual beings who are unable to and should not parent. Um, and on added to that, of course, and I guess maybe the foundation of that is the history of eugenics in this country. So I think, policy has significant implications on research that has significant implications on policy as well. So what I really feel like, one of the reasons is that this area of research was missing was because of the eugenic history in our country.
Absolutely. Yeah, and as you mentioned, those kind of connections with this gap due to our history of eugenics and kind of these misconceptions or biases people have that folks with disabilities may not be parents. I would imagine that has some significant influence on your policy and advocacy work as well. Would you mind talking a little bit more about kind of that intersection of your research and your advocacy work, and kind of some of the work that you're doing for disability policy specifically in your role at
Brandeis University?
Brandeis, thank you.
Sure. So, the way I increasingly see myself as sort of the scholar activist, and as a scholar, I'm involved, and I'm passionately interested in creating knowledge, knowledge that's generalizable. But I'm also interested in actively engaging with communities, and also ensuring that the research that we conduct is relevant to communities that the research is about. So and also that it is accessible to them, and that we disseminate the information not just in our ivory tower peer-reviewed journals, but we actually disseminate the information that it is accessible to multiple stakeholders who are involved in that research project, or should be involved. So that's something that's I think is, as I get older, as I see, is that is increasingly important. The other piece I think that we all need to ensure is that our research is centered around the voices of disabled people and the needs of disabled people. And this separation that we've had for a long time between the researchers and people with disabilities, that needs to be, torn down. So I think whether, and the third part, which is also something that that needs to happen, is that our research needs to be policy relevant. And in order for it to be policy relevant, it needs to be centered around the voices of disabled people.
Absolutely. That makes sense. And so, I really like what you just mentioned about, centering your work around the voices and needs of disabled people, but also that you try to make sure that you disseminate your work outside of journals that, primarily academic researchers have access to. What are some kind of different ways of disseminating your research that you've tried before and seem to have some success in reaching your stakeholders?
Sure. So it's not an easy task, and it's something that we're constantly working on at the Laurie Institute. We have a phenomenal communication specialist. His name is Mr. Finn Gardner. He is absolutely brilliant at making our materials accessible to all. And so one of the sort of the tenets that we follow is that in all our research studies, when we publish something in a peer-reviewed journal, as soon as it's accepted, we create different ways of different sort of ways of the of materials, or whether it's in terms of like a data brief that's very simple and easy to read. We ensure that the material is in plain language. We sometimes create like little video snippets, and so different vehicles of disseminating the same information, so that people with different types of disabilities, people with different kinds of learning styles, and also ensuring that the language is simple and easy to read. And we have this in our websites. We also disseminate it through social media, and really try to get it across to as many stakeholders and communities as possible. Now, having said this, I have no doubt that we're not reaching everybody that we should. And I think that's something that's a continuous conversation on our part at the Lurie Institute, is how do we ensure that this information matters? And the only way it matters is, or one of the only ways, is that it reaches who it should be. So we're also, for example, for our National Research Center for Parents with Disabilities, we have information that should be relevant to the legal professionals, to social workers and child welfare workers. So we create this material, but creating it doesn't actually always mean that it's going to the people that matter. So we're again we're always continuously at the drawing board, trying to see how do we make sure that it's going through across to all the stakeholders that it should.
Wonderful, thank you. And sort of in addition to something you mentioned previously about also making sure you're centering your work around the voices and needs of disabled people, have you, I was hoping you could tell us a little bit about some of the kind of key players or allies, whether these are self-advocates or other researchers or clinicians, but just some of the key players or allies in the field of disability and public health that have helped you to kind of progress your research to where it is today, and kind of have helped you along your journey.
Sure. And I think this is something, Liz, you're probably realizing that we never do anything alone, right? And we're a product of so many conversations, so many different mentors, colleagues, partners. When I finished my PhD, I was sort of struggling. Like, I'm not quite sure. I knew I was interested in disability, but I didn't really want to focus on the exact kind of research that I had done for my PhD. So I landed on this job, and there were no postdoc opportunities. There was barely anybody at that time. This is 1998 that were actually doing disability research. So I landed on, at that time, a job that was, in hindsight, was the perfect opportunity. It was to work at the Mass Department of Public Health, and they had just recently been funded by NIDLR and the CDC to conduct a longitudinal study of adults with physical disabilities. It was the first of its kind. And there was a small research team, was absolutely has even to date influenced the work that I do and how I do it. And included in that was one of the PIs is Alan Myers. And there were other people involved as well, who are Dennis Heafy, who is works for the Disability Policy Consortium in Massachusetts. There is also another disability activist and advocate, Paul Tupper, the late Paul Tupper. He is no longer with us. And there were two other maternal and child health researchers who were really, really interested in disability, and is Debbie Allen and Debbie Klein Walker. So this was and as well as another public health advocate and activist is Nancy Wilbur. So this was the small team, and I was just fresh out of grad school, and really, and I was, the sponge, and I was sort of soaking it all in. But really, I don't think I would be the researcher I am today without their mentoring. And I still work with Dennis even to date, and I still learn from him.
That's wonderful. Wow, that's incredible to still have some of those collaborations, over over all this time. And then also you mentioned that Alan Meyer was one of the kind of key players that you had worked with, which is really well fitting since you received the Alan Meyer Award in 2017 for all of your contributions to disability and public health. So, this question probably is even more meaningful to you, but what did that award mean to you personally, and how do you think that recognition influenced any future work that you've done since then?
Sure. So Alan was he was a large figure. I mean, he was just absolutely passionate about improving the lives of people with disabilities and also centering public health research. So even to date, and you know this, is that in most public health schools, for example, disability is not included, and most people who come out of an MPH or a PhD program in public health don't actually even see health disability as part of the health equity conversation. So this is something that I've really learned from Alan. And so first of all, receiving that award, I was delighted, honored, and particularly it brought me back to the many conversations that I had with Alan, just about centering disability within public health. And I think that, there's a lot of things you take and learn from people. And one of the pieces that I think that I have taken from Alan and my conversations with him is really is centering research on the lives of people with disabilities. And at that time, that was really sort of cutting edge or not really done. And there were the researchers and the ivory tower and then the rest of the world. And I think that this was something he was deeply passionate about. And I think that's it, along with Alan, the rest of the team really sort of drilled that into me. And I think that's made me the researcher I am today.
That's wonderful. Thank you. And so, we keep coming back to this concept of centering your research around the voices and needs of disabled folks. Do you mind sharing a little bit about how you do that in your work? And it could be, how it's progressed over time or what you're doing currently.
Sure. So there's multiple ways in which we do that, and I'm going to admit it's not perfect, and it's a practice, it's a process. One of the ways is really to the Lurie Institute is hiring people with disabilities who are working with us in creating the research. So we're co-creating the research as opposed to just involving researchers with disabilities at the end of a research process or study. And I think the part that I also is critically important for me is for every grant or project that we conduct is to understand the perspectives of people with disabilities by including them right from the beginning. And I think the part that I feel like where I can make the greatest contribution is also mentoring the next generation of researchers with lived experience. So mentoring the next generation of researchers with disabilities, so that this disability section is really led by, centered around people with disabilities.
Wonderful, thank you. And so this next question sort of aligns with what you've just finished talking about as far as mentorship, but what advice do you have for future disability and public health researchers, advocates, clinicians, and leaders?
Sure. What advice do I have? first of all, I think it's our collective responsibility to ensure that people with disabilities are part of our research, part of our the conversation that we're having, part of it's our responsibility to mentor that next generation of researchers. And none of us can do this alone. We should all do it together. And the second, I always, and this is something I tell most students, is as well as, always see who's not in the room. And inevitably in the work that we do, it's usually people with disabilities, but even if it's about people with disabilities, are we ensuring that, for example, Black and Brown populations are represented in our research? And I think so the message is for our research that it needs to be intersectional. And the message to me, it's critically important. I don't think we do enough research at the intersection of race and disability. And if there's something that really needs to be done, and the gaps are obvious, the disparities are huge, and we need to center our research in that area.
Absolutely. Thank you. Well, thank you. So those were all of my questions. Do you have anything else you'd like to share? Any specific stories or experiences about your work or your time as a part of the disability section?
So the disability section is I call it my professional home. And I remember, I think the first disability section I attended was in probably 2000. I was, I think my son was probably 2 years old, and now he's 22. So it was, and I remember just being completely I was fresh out of grad school, and I was, didn't know a lot about the field, but I was ready to learn. And I felt then, and I still feel now, it's a small group of researchers, but growing, like yourself, who are dedicated, passionate, and just incredibly collegial, and are ready to help, ready to guide, ready to mentor, and I think that, I'm not sure you get this everywhere, but it's certainly present in the disability section. And a lot of my partnerships, my work, even to date, has come from different meetings I've had at the disability section. And I get that same feeling as I'm walking into whatever room 402 in some random convention hall, walking into the disability section, is seeing my colleagues who are really my friends now. And I want to commend people like you, Liz, who are our next generation of researchers. And you guys are doing a stellar job. I mean, this is a great, doing a podcast like this is an amazing way to reach people that we normally wouldn't be reaching. So thank you, and congratulations.
Oh, thank you. Thank you so much. We really appreciate your time today.